When should you consider an elimination diet for mental health? My name is Dr. Dutton. I'm a board certified adult psychiatrist and a metabolic psychiatrist, which means that I look at the overlap between mental health and metabolic health. And although I recommend that generally everyone work towards eliminating ultra processed foods, meaning things with refined sugars and carbohydrates, we also know that for some people, elimination of other things can be beneficial as well. So some of the things that I'm talking about are things like common irritants and or allergens for the GI tract. So things like dairy, gluten, eggs, certain nuts, soy. Additionally, there are some foods that are just harder to digest and or can cause issues with absorption of certain micronutrients. This could include things like other grains in addition to wheat, as well as nuts, seeds, and legumes. For some people, they have intolerances related to this, or plant chemicals are going to potentially impair the body's ability to absorb vitamins, micronutrients, minerals, other ions. And of course, the most extreme elimination diet is going to be trying a carnivore diet, where you're basically eliminating almost all of the potential irritants for symptoms. That is, if you go dairy free. And the other thing to consider with that is high histamine foods. So some of the aged meats and things like that can have high histamine, and sometimes histamine is an irritant for some people. So all that to say, let's kind of jump into it. What are 3 different situations where you might want to consider an elimination diet? So one is going to be if you tend to have a lot of GI upset and issues. So we know that especially for individuals who have anxiety disorders, they have a much higher risk of having gut issues. So that might look like bloating, reflux, nausea, diarrhea, constipation. And we know that there is not only a direct connection between the gut and the brain through the vagus nerve, but there's also chemical connections because the brain sends out neurotransmitters that affect the gut and the gut microbiome. And the microbiome, meaning the gut bacteria, are going to send out chemical signals that are going to affect the brain. If there's dysbiosis, meaning an unhealthy bunch of bacteria in your gut, then this is going to negatively impact your mental health. And similarly, if you're having issues with mental health, the signals that your brain is going to send down to your gut are going to negatively impact your gut. So you could try eliminating those potential irritants like I talked about. Also, there's something called the FODMAP diet that can be worth checking out. This is going to eliminate foods that have certain sugars that contribute to that dysbiosis. Second is going to be if you have generally medically unexplained symptoms or inflammation. So this could be things like chronic fatigue syndrome, some autoimmune disorders, or maybe you just have lots of non-specific symptoms like numbness, tingling, fatigue, dizziness, and the doctors can't find out what's going on with you. These could also be good reasons to try an elimination diet, especially one that focuses on decreasing inflammation. And then lastly is basically if you've tried multiple antidepressants or other psychiatric medications and you've tried different therapies and it's just not working, essentially you're treatment refractory. If this is the case, then it may be worth looking at your diet and trying to eliminate some things to see if you notice any improvement. Because believe it or not, having a gluten intolerance or a dairy intolerance and continuing to consume those things can actually lead to mental health symptoms for some people. So how do you do an elimination diet? So generally you're going to want to eliminate that food for at least 3 to 4 weeks before trying to reintroduce it. So you can observe if you're having improvement in symptoms during that elimination period. And then more importantly, if you experience a worsening of symptoms once it's reintroduced. Now, the reason I say that a carnivore diet is the ultimate elimination diet is that you can kind of eliminate everything for 3 to 4 week period, and then you can gradually reintroduce each thing one at a time to see what is negatively affecting you. So that's good if you just have no idea and you just kind of want to rip it off like a band-aid. Now, one caveat I will say is that whenever you eliminate food or a food group or whatever, you have to think about how are you going to make up those calories? How are you going to make up that nutrition? And sometimes that can actually cause disequilibrium in your system and cause worsening symptoms. So for example, I gave up dairy, to see if that was contributing toward anything. I have migraines, whatever. And so I actually felt worse with this. And then I later learned that it's probably because I have an intolerance to nuts. And so I replaced a lot of my dairy with nuts, right? Like nut milk, trail mix, nut yogurt, whatever. So that's important to keep in mind as well. If you've had an experience with an elimination diet that's improved your mental health, please share in the comments below. I'd love to hear about it. Wishing you all good mental health today, and I'll see you in the next one.